Thanks for listening to The Spark, Medical Education for Curious Minds, where we bring you the latest ideas and insights from faculty, students, and staff in UCSF's medical education community. I'm Megan O'Connor, Instructional Designer with the Technology Enhanced Education Group.
And I'm Karen Fleming, Communications Manager for the Office of Medical Education. In this episode, we're celebrating the 11-year anniversary of PRIME, the program in medical education for the urban underserved. PRIME US is a 5-year track at the UCSF School of Medicine and the UC Berkeley-UCSF joint medical program for students committed to working with urban underserved communities. We talked to medical student Adlai Martinez, who's completing her final year of the PRIME program and who finished community engagement work with the organization Mission Girls, an after-school program for girls in grades 3 to 8 in San Francisco's Mission District. We'll also hear about the program's goals, mission, and successes from Dr. Leigh Kimberg, PRIME Program Director for the past 3.5 years and a UCSF Professor of Medicine, and Dr. Monica Hahn, who was a student in the very first PRIME class 11 years ago and who is now Director of Evaluation and Inquiry for PRIME. She's also an Assistant Clinical Professor at UCSF's Women's Health Primary Care Center. I'm here with fourth-year medical student Adlai Martinez, and we're going to talk about her experience in the PRIME program. So Adlai, as a student, what piqued your interest in PRIME?
Well, I dedicated the majority of my time prior to medical school working with communities in health and educational settings. And a lot of my motivation to even apply to medical school was based on my involvement in community projects in public health and my own personal experiences growing up in one of these communities. So it seemed like a great fit for me.
What aspects of the program most appeal to you?
I think that the network and the community that you create. I was in a new city. I've never lived in San Francisco, and I really wanted to get to know the real San Francisco. What are the communities that are underserved here? Where is the most need? What community organizations already exist? And how can I contribute as a medical student, as a physician, as someone who's not from San Francisco in a way that is really catered to the needs of the community? And that's what appealed most about PRIME, because there are people who are part of the staff that have been living in San Francisco for many, many years, are really integrated into the community. They're physicians who are very active and in advocating for their patients, and I wanted to be a part of that. And I knew that the students that wanted to be a part of that as well were people that I wanted to surround myself with.
What are some of the highlights for you so far, reflecting on your experience to date with PRIME?
I'd have to say it's been the people. So my PRIME class, the PRIME faculty, the staff, they're a group of extraordinary and compassionate humans who really spend all of their limited free time for the advancement of others. So PRIME students are amazing. We have students that have been leading national movements, protests, rallies, legislative visits. They've been serving as mentors for at-risk youth. They've been creating partnerships with community organizations, and they've been making a lot of strides within the UCSF medical education community to advance diversity and equity.
Can you give us some details in terms of the day-to-day aspects of being part of some of the community engagement work that you've seen with PRIME?
Sure. So most of the community engagement work happens in the first 2 years. When you enter third year as any medical student, it's very hard to keep up with a lot of your community involvement. The day-to-day, your first year, is you have bi-weekly or weekly sessions with your PRIME community, your PRIME cohort, and we meet with different community organizations. We go out to places like the Mission, the Bayview, Chinatown, to get to know a lot of the people that are running these organizations. And from that first year experience, you select a community engagement project based on your interest, based on the community that you want to serve. And the relationships have already been created between these organizations and PRIME. I did most of my work between the summer of first and second year. I worked with Mission Girls. It's an organization that serves girls that are 8 to 21 years old and provides various recreation, prevention, and interventional programs. And I did more of an educational program about substance abuse, about healthy and unhealthy relationships, about conflict resolution. And I took my time to create these lessons, to go to Mission Girls, to get to know the organization and the girls involved in the program.
How do you anticipate that your experience with PRIME as a student will shape and impact your future practice as a physician?
So I see aspects of Prime of every interaction that I have with patients. Prime has taught me to take note of social economic situations with every patient. Do they have somewhere to live? Are they able to afford the medications that we prescribe? Are they at risk of deportation? All of these questions run through my mind when I'm meeting a patient for the first time or when I'm discharging them. And I think I will continue to carry that with me throughout my entire career at an individual level, but also what Prime has taught me was that this is more than just an individual level problem. This is a whole structural systemic problem within medicine that creates health inequities. And so I fully intend to use my master's in public health that I earned last year at UC Berkeley in health policy to be more involved in health policy as a physician. So through the MPH, I learned skills and was able to write and testify for legislation in the state of California, and I learned how to advocate for legislation and advocate for the rights of marginalized communities. And so I fully intend to do that for the rest of my career.
Now that we've heard from medical student Adlai Martinez about her experience in Prime and her work in helping lead outreach events with young people about health disparities, let's hear from Prime's program director, Dr. Leigh Kimberg, who gives an overview of Prime, its goals, mission, and achievements.
So, Leigh, what was the impetus for developing and growing Prime?
Prime grew out of the needs, the healthcare needs, and the health needs of the state of California. So California is the most populous state in the country. It's one of the most diverse states in the country. It's racially and ethnically, culturally very diverse. There are enormous health disparities in the state, and the healthcare workforce in the state is not sufficiently diverse or able to address those health disparities. So the Prime programs were created throughout the state, actually, not just at UCSF and UC Berkeley, in order to address these health disparities. And UCSF and UC Berkeley partnered to create Prime US, which is the program in medical education for the urban underserved. That program was piloted in 2006 and then officially launched in 2007, specifically to figure out ways to better care for underserved populations in California. And our mission has grown since then.
So you've been director for several years now. Specifically for you, what sparked your interest in being part of Prime?
I have been a primary care doctor in San Francisco in the Department of Public Health for over 20 years and also doing violence prevention work locally and nationally. I had always been very drawn to staying closely aligned with directly providing primary care. When I heard about the Prime program and I heard about the opportunity to train and nurture, mentor, support students who were specifically dedicated to eliminating health disparities and promoting health equity. That seemed like a brilliant opportunity that I couldn't pass up, and absolutely transformative in my life to have the opportunity to work with these dedicated and passionate students as well as the Prime team.
How have you seen the program evolve since its inception?
So the most obvious way the program has evolved is that it has actually grown. So now we have 95 graduates throughout the state, and the really incredible opportunity to create a network that would address health equity throughout the state. So we're just starting to figure out, I think, how to harness the power of the graduates of the Prime program. So that's the most obvious, that we have now a really large Prime community that's poised to do work together. The team has developed so many innovative and creative curricular opportunities to really solidify a diverse learning community, bringing together students, some of whom are from under-resourced backgrounds themselves, together in a diverse community, and then creating a safe and supportive and creative learning space for those students to work together with faculty and staff mentors has helped the program evolve. I think early on, the mission, the stated mission, actually, is to nurture, support, and equip medical students to care for underserved populations and to become leaders in the care of underserved populations. And what I've noticed even over the last 3.5 years that I've been here is that our understanding of health equity and how to achieve health equity is evolving, and the mission actually seems even more broad than when we started. One of our students coined the phrase that PRIME is an ecosystem for creating health equity. Another way PRIME has grown is that our community engagement curriculum has become increasingly robust over the decade that PRIME has been in existence. Aisha Queen Johnson, who's our administrative program director and is an expert in community engagement and service learning, has led many of our efforts in creating a robust community engagement service learning curriculum. Over the years, we've been able to develop very strong longitudinal relationships with community partners. That has afforded PRIME the opportunity to deepen students' learning about health equity and about the best principles of community engagement, because we work with partners who understand the learning objectives and the learning needs of our students.
You spoke to a lot of the overall successes of the program. Are there any specific achievements you'd like to call out that you haven't mentioned already?
Sure. We have so many things to be proud of in the PRIME program. We're always so proud of our students, first and foremost. They're our best spokespeople. They inspire us with the work that they do while they're in medical school and the work they do after they graduate. Their passion and their shared mission to promote health equity creates just such a brilliant learning community for all of us. Our team works together very beautifully, and we have a diverse team that really models for the students how sharing diverse perspectives can create the most powerful outcomes. We have an interdisciplinary team with 2 social workers and physicians in different fields who lead the program. Our community engagement curriculum is really a jewel in the crown of PRIME, and the community engagement curriculum has now also influenced curriculum at UCSF as well. One thing that has remained true about PRIME and that we are most proud of is that we've been able to create a dynamic learning environment in which curriculum changes from year to year, yet we are always driven by the mission to promote health equity. We stay true to our principles of working from a vantage point of cultural humility and lifelong learning about identity and privilege and how these aspects affect health equity.
Dr. Kimberg's enthusiasm and passion for PRIME certainly makes me excited for students in the program and for their work as future physicians working to alleviate healthcare disparities. Let's see what Dr. Monica Hahn found most impactful during her medical student training in PRIME. So I'm here with Dr. Monica Hahn, who's a family physician and assistant clinical professor at UCSF. She is also in a new role at the School of Medicine as Director of Evaluation and Inquiry for the PRIME program. Dr. Hahn, as a student during your medical school career, what piqued your interest in the program for PRIME?
When I first learned about the PRIME program, I was actually in public health school, and I had just finished undergrad at UC Berkeley studying biology and ethnic studies. And I was really passionate about social justice and health and the connection between the two. But medical school wasn't really in my mind at that time because I didn't think that doing a career in medicine was really going to give me the tools to do what I wanted to do, which was to be a public health advocate and activist and be somebody who could really promote health equity and the health of communities and really focus on underserved communities. So that's why I was in public health school at the time. And then, I read the description of this new program that was coming out. It was a big new program called PRIME, had never been done before. And I just felt like the words leapt off the page and just really spoke to me, and really felt like this was a program made just for me. Like if I were to have, dreamt up what my dream medical program would have been, it would have been that program. And it was, this program to cultivate leaders in underserved medicine, to promote health equity. It basically was just speaking to me. And so I realized then that my passion for social justice and my passion for promoting health in communities and eliminating health inequities was really something that could be done by becoming a doctor. And I realized if I was going to become a doctor, that's the kind of doctor I'd want to be. And so that's what really piqued my interest in the Prime program when I first heard about it.
So you spoke to a lot of the aspects of the program that most appealed to you. Looking back, what are some of your highlights reflecting on your experience as a medical student in the Prime program?
So I think the biggest highlight of being a part of the Prime program was truly feeling like I was part of a family, and that it was a safe space for me to truly be myself and really cultivate my passion for social justice and health and the interconnectedness of that, because the other people in the program felt the same way. And because we really shared that core value, even though we all came from very diverse backgrounds and very distinct personal life experiences, we all shared that core value and the values of Prime. There was a big burden on students like me who were really had a lot of passion for health equity and diversity, but couldn't quite, we just didn't always have the right vehicle for being able to do what we needed to do to really advocate for that. And so when I was in a room with Prime students, I felt like, okay, now we can have real conversations because we all are coming from a similar kind of baseline of knowledge around these issues. And, we would have workshops on unconscious bias. Like, we would all kind of get that and be using that as a jumping off point to have more discussions towards real solutions, which was really just an incredible experience to have during medical school, which is always such a daunting time for all of us.
What community engagement projects did you participate in Prime?
So there's the good thing about Prime is there's always all kinds of community engagement projects that are going on. So there's several that I was lucky to be a part of. The main one that I did was actually for my master's thesis while in the Prime program. It was a community-based participatory research project that I completed at Asian Health Services Youth Program, which is a place where I had a community partnership prior because I had worked there prior to medical school. And it was called a Photo Voice project. A Photo Voice is a community action method that basically puts cameras in the hands of people living in that community. And in my case, I had given cameras to low-income Asian youth living in Oakland, and basically asked them to just take pictures of things that they felt were the most important health and social justice issues in their community. And basically we use those photos as sparks to ignite discussion and dialogue about what are the strengths and challenges in your community, and really kind of brainstorm solutions to these issues. And what I really love about this method is that it puts the power in the hands of people who traditionally have less power. So youth, immigrant communities, low-income youth, and basically says, these are the people who are the real experts in the community about what are the potential challenges and strengths and what are the possible solutions. So we had a really great time doing that project, and it ended up being my master's thesis.
Looking back as a faculty member at UCSF now and having been in the first Prime class, what do you see as being the program's biggest achievements so far?
I'm so proud to be an alumnus of Prime, and I feel like there's so many great achievements, but I just think I'm always so happy to see how much the tiny program has grown in 10 years. When I was in the very first class in 2006, there was only 10 of us in the program, and now there's so many graduates, and there's so much amazing work that the graduates have done, and that's probably what makes me the most proud. I think a very specific achievement that I feel like you can really see and is very palpable right now is just the cultural shift that I think Prime has helped bring about in the wider UCSF community, as far as bringing a cultural shift towards understanding the importance of cultural humility, the importance of health equity, and also the importance of caring for patients of underserved backgrounds. I think people get it now. Just in general, there's a lot of new initiatives that are really valuing diversity, like the Differences Matter initiative. Often when there's a lot of activism, student activism going on campus, like the Do No Harm campaign and the White Coats for Black Lives, often you'll see that it's Prime students that are really on the forefront that are doing a lot of that work. I can't be more proud when I see that work going on. And I think Prime often gives a legitimacy to work in the area of health equity and diversity inclusion that maybe we didn't have before.
So specifically for your practice now, how did your experience with Prime then as a medical student shape your practice and your interest now in healthcare equity and helping bring more equitable care to patients?
So starting back when I was in my very first year of Prime as a new medical student, my main passion was caring for people of underserved backgrounds, for advancing health equity, and I was particularly interested in reproductive justice and HIV prevention and treatment. And I'm so happy to say that today it's basically, if you were to ask me what are my interests, those are basically my same interests. So I'm so happy that those things have not changed. And in my current work, I'm co-directing a family-oriented HIV clinic at the Family Health Center at San Francisco General Hospital. I also get to work with pregnant women living with HIV at the Hive Clinic, also at SF General. And I also run a HIV pathway concentration program for family medicine residents who are interested in becoming HIV primary care providers. So I know that all the tools that I gained out of Prime are why I'm able to do the work that I do now, and that I find my work today so rewarding, and I feel really thankful that I get to do this work. And I know that I am the doctor I am today because the Prime program gave me those tools. And I think I ended up staying at UCSF for residency and staying here as faculty after that, mainly because I was kind of following my mentors, and many of whom were through the Prime program. And so it's really rewarding to get to be now a faculty in the Prime program, just the very place where I kind of started to just figure out who I was as far as what kind of doctor I was going to be early in medical training.
Hearing from Prime students, past and present, and from the program's director is a timely and fitting way to celebrate the program's 11th anniversary this year.
We hope you're subscribing to The Spark on SoundCloud. Stay tuned for our next episode in October, Breast Cancer Awareness Month, as we feature interviews with students and faculty about the latest advances in breast cancer research and patient care. The music in this podcast comes from Poddington Bears Egress, licensed under CC by NC 3.0 and available at the Internet Archive.